What is universal health care? Is universal health care a bad thing? Universal health care is a system where all eligible residents of a political region are granted health care. Usually, universal health care is a single-payer system, where the single payer is the government. In the United States, Medicaid has served as the best representation of universal health care, if the universe of eligible residents is constrained just to those with exceptionally limited means. About 50 million of the more than 304 million American citizens are provided medical care under Medicaid, at an estimated $204 billion cost. There are nearly as many people without health coverage, according to some estimates, as there are people on Medicaid. One state, Massachusetts, adopted a requirement in 2006 that all citizens obtain health coverage, and they worked to subsidize the cost of that coverage for those citizens earning up to 3 times the federal poverty level, which today means Massachusetts provides full payment for a family of 4 making $21,000 a year, and partial payment for that same family if they earn up to $63,000 a year. Only a few years into the coverage, Massachusetts is already groaning under the weight of the system. What had been expected to be a $725 million program in 2011 is now a $1.35 billion program covering just 342,000 people, with cost overruns and increased sign-ups at fault. Do the math in your head. $1.35 billion to cover 342,000. There are 304 million people in the United States. Using the Massachusetts plan across the country would cost $1.2 trillion each year if the government became the sole provider of health care. The pro-universal health care people cry that companies won't just give up providing health coverage, so the cost won't be that high. That hasn't been the case in Europe or Canada. In Canada, where doctors are generally paid per visit or service, companies do provide insurance for their workers, but the insurance only covers things the government doesn't provide, like dental work. Europe has government-run health plans for basic, or what they call sick, coverage. Citizens there have to pay for supplemental plans to receive extra coverage, and complex cost schemes have created a cottage industry of what are called medical tourists. Price inequities are so great that people take vacations to get dental work. Is that the goal of the White House, to turn our vacations into chances to get root canals? You also notice that President Obama isn't proposing that we adopt any of the current government health care programs, Medicaid, for instance, or the VA system, as our new government health care program. No, having screwed up in the past, we're supposed to trust them to get it right this time. Putting in place universal health care will saddle the country with trillions of dollars in expense. It will ruin the best health care system in the world. It will reduce quality of care and access to care for more than 150 million Americans, so the people Medicaid doesn't cover can get basic coverage. Why not simply extend the Medicaid coverage to those who need it? We'll get saddled with a federal budget increase of trillions of dollars just to figure out that we had the best system in the world before we ruined it. This has got to stop. We have to stop believing these inane lies that universal health care is affordable, required, necessary, or even helpful. This isn't about President Obama wanting health coverage for all Americans. This is about creating an emergency so he can come to everyone's rescue. This is about putting a program in place that will expand government control and limit personal responsibility. Tell truth to power. Hear the real story. Think for yourself. Join the conversation at econmilitia.com. Take back your inalienable rights.